Okay, so good morning and welcome to General Finance of August 16th. I'll first begin with any identification of any media on the line.
Victoria Gray from the Journal Island News.
Thank you. Good morning, Victoria.
Good morning.
Is there any representative from the Two Row Times? Seeing none, I'll now move to any changes or additions or deletions to the agenda. I see Wendy.
Thanks, Mark, and good morning. Can we add bread and cheese?
Yes.
Thank you. I have a quick question too, but maybe I can just ask it at the end about Chiefswood Road.
Sure.
Thanks.
Is there anything further?
I'll move.
Second.
Thank you, Michelle. Moved by Michelle and seconded by Carrie to adopt the agenda of August 16th, the one addition in question at the end. All in favor? Any opposed? Seeing or hearing none, motion's carried. I'll now move to number 3, which is a delegation and presentation from Sarah Curley-Smith of the Emergency Control Group in relation to the COVID Alert System version 2.2. So good morning, Sarah.
Okay.
I'll just pass the floor right to you, Sarah.
Okay, good morning. Thanks for having me here today. Today I'll just be going over some changes that we have gone through for the response framework version 2.2. So in the last update, we stated that we would do a review on an ongoing basis to ensure that it's staying relevant to our context and any changes that need to be made. So I'm just going to be going through the document. There haven't been too many changes, but I'll just highlight some important ones for council and people to review. So this is version 2.2. So with the main change within this response framework is to better align our alert level green with the provincial regulations for step 3 of the provincial reopening plan. So everything that you see highlighted in yellow are changes that have been made. So this paragraph right here just states that alert level green is better aligning with the provincial regulations for step 3 of the provincial reopening plan. And this is to ensure that businesses and organizations are equitable to what's happening off reserve. Just to note, given our current context with the Delta variant, it is highly recommended that people receive the COVID-19 vaccine with 2 doses to ensure maximum protection. And that's what this paragraph is stating. Being fully vaccinated against COVID-19 provides the maximum amount of protection from variants of concern and are proving effective against serious illness. And I'd just like to note that we do have this statement previously in regards to traditional medicines. This is one way to strengthen your immune system, but the recommendation is to maximize protection of vaccination, maximize your protection with vaccination. So a summary of revisions are aligning the capacity restrictions for sectors in alert level green with the provincial capacity restrictions in step 3. And then linked here is if there are further questions regarding recommendations for your specific sector, they can be found in the Ontario regulations. And it's just to note that it's just guidance that's available, not that it has to be implemented, just a resource provided. within the objectives of the framework, number 1 is to mitigate the risk of increased transmission. And number 2 is, for this response framework, is to protect vulnerable high-risk community members. And we added in this statement that, or community members who are unable to receive the vaccine. For example, children under 12, our elders are still at risk, those who are allergic to the COVID-19 vaccine, and those who are advised by their primary care provider to not receive the COVID-19 vaccine. So what we know at this time is that not everyone is eligible for the COVID-19 vaccine. And we're also continuing to protect those individuals as well. There have been some language changes. So wearing a non-medical mask, that's just to stay consistent with the updated language changes. Key risk factors for transmission. As it has been stated previously, close contact with other people, being indoors, crowded places, unprotected, so not using personal protective equipment such as face coverings, prolonged exposure, so contact with other people for an extended period of time. And what has been added is unvaccinated. So individuals who are not vaccinated are at a greater risk of spreading COVID-19 if they get COVID-19. And that is based on the most up-to-date information that we have available. Just to review our alert level evaluation and update procedure. So each week and as needed, the IMT evaluates the level of risk, provides a summary of the risk factors with a recommendation to maintain, increase, or decrease restrictions to the emergency control group. The risk assessment is based on the core monitoring indicators, which include virus spread and containment, our community health system capacity, our surrounding area healthcare system capacity, and community compliance to the public health measures. ECG then informs 6 nations of the Grand River Elected Council of the risk assessment evaluation and associated recommendation. Elected Council will make the decisions to either approve or reject the risk assessment recommendation. If Council approves an alert level change, then the community is then informed. These are the indicators that are used. It hasn't been changed. So this all remains the same. Recommendations for updating alert level system. A major signal moving to black would be evaluated at a very high risk. So this would mean that we have a lot of COVID-19 cases. We have our community health system capacity is overwhelmed, and that would signify a very high risk to the community. Minor signal, a weekly risk assessment is evaluated at high risk. So we would likely be experiencing a number of cases, but our community health system would be able to support the contact tracing and the testing, and EMS would be able to respond to emergencies. And that's really the goal, ensuring that our community health system is not overwhelmed. Maintaining the current position would be a moderate risk. So I might be seeing some COVID-19 cases, but our community health system is able to respond. Decreasing the alert level, so 2 consecutive weeks with low risk and a 3% increase in vaccine coverage. At this time, we're currently at the lowest alert level. So we are just monitoring for any needed changes for increase in alert level. A change for sports organizations. Sports organizations should follow their respective associations in conjunction with the facility restrictions outlined by the alert level. So that means any sports organizations that have an association that has return to play plans, the sports organizations would follow those associations' recommendations. If a team sport is within a facility, then they would also need to follow any specific restrictions to the facility. So if the facility requires screening to go into the facility, then the team sport or the organization would then need to follow the restrictions in that respective facility. This was the same recommendation that you should require 2 doses for maximum protection against COVID-19 and variants of concern. Added in here is businesses and organizations are responsible for the safety and wellness of customers, clients, and patrons when engaging with their service, program, or event. This is to ensure that businesses and organizations have safety plans in place to mitigate the level of risk within their business or organization. And again, that is just for the safety and wellness of the community. So group sizes for alert level green. This was changed to follow capacity restrictions of the facility or businesses, and unmonitored gatherings follow public health precautions, limit group sizes, and prioritize outdoors. So what we know is having events or gatherings outside is going to be safer than having outdoors and than having events indoors. So just trying to reduce the level of risk as much as possible. Outdoor and indoor recreational facilities. This now states it's open with capacity restrictions to allow for 2-meter distancing. So what that means for the facility is they would need to do a calculation to ensure that whatever capacity is noted, they need to allow 2-meter distancing. Again, team sports follow the respective association guidelines and facilities public health measures in place. And also to note in this section, at this time, ECG recommended continued no contact for team sports. Gyms and
I have
fitness.
a question. It's Wendy.
Yes.
So in your other box, the second bullet, training only. So does that mean teams can't play? They can only train?
So in an alert level red, that's what that would mean. So at that point, if we're in alert level red, we would be having a lot of cases within the community, and our community health system could be getting overwhelmed. So that was to reduce restrictions.
Okay, I'm sorry, I missed it because I just thought it was another, because it's the section before it is all one. So I thought you were just referring to green. So, sorry, it was my misinterpretation of your chart.
Yeah, sorry about that. So teams sports follow the respective association guidelines. That's for alert level red, yellow, and orange across all of here. And an alert level red is when we would recommend that it only be training only. Gyms and fitness, there were no changes as we already aligned with the provincial guidance, and that was capacity restrictions to permit 3-meter distancing. And that is due to the increased risk within a gym and fitness setting. So this does align with the provincial recommendation. Again, schools, childcare, and post-secondary across all alert levels, open with restrictions based on Ministry and Ohsweken Public Health guidance. That remains the same as in 2.1. Children's day camps. Again, this remains the same as 2.1 across all alert levels. It's follow Ministry of Health safety guidelines for day camps, and cohorts should not mix with other cohorts. Restaurants and food stands across all alert levels. There were no changes with the exception of buffet style and karaoke permitted. Emphasis on hand washing, distancing, mask use when not eating, or less than 2-meter distance in the case that is a business or organization would like to implement that in alert level green, it is allowed. Personal care services, no changes were made, as this already stated, open with capacity limited to permit 2-meter distancing. And again, campgrounds, alert level green, already stated capacity restrictions to permit 2-meter distancing. Organized public events, religious or ceremonial activities has just reiterating those holding events are responsible for the safety and well-being of their attendees. So just ensuring that there are safety plans in place to reduce the risk and have a safe event. And that's what this states. Safety plan must be in place to reduce risk of COVID-19 transmission at event. So this states capacity cannot exceed 50 people indoors, 100 outdoors with physical distancing. What the highlighted portion states is that gathering sizes do not apply with respect to attendance at a business or place to which a capacity limit is set. So this means if you were to have an event where at a facility that already has a capacity limit set, you would follow that facility's capacity limit. So for example, rental of the gathering place, for example, an event would follow the gathering place capacity restrictions and set and ensure capacity restrictions are visible to patrons prior to entering and advertise their capacity in a visible area prior to patrons entering. So this is generally capacity cannot exceed 50 people indoors, 100 outdoors when you are not in a facility that already has gathering sizes implemented or capacity restrictions. Meeting and event spaces. So capacity restrictions to permit 2-meter distancing. And again, that would be in accordance to how large the facility is, would be the capacity restrictions. Retail remained the same. 2-meter lineups, patrons congregating outside 2-meter distance and face coverings required. Implementation of 6 nation health and safety guidelines. The bingo hall, alert level green, states capacity restrictions to permit 2-meter distancing. Motorsports and speedway, again, capacity restrictions to permit 2-meter distancing. Performing arts, again, capacity restrictions to permit 2-meter distancing. Large community gatherings. So this large community gatherings are things that a large portion of the community would be involved in. So things such as the 6 Nations Powwow, 6 Nations Fall Fair, Bread and Cheese, Solidarity Day events. So basically community-wide events. Capacity restrictions to permit 2-meter distancing.
I have a
And
question on that one, Mark.
large community gatherings.
Yeah, so Caledonia's fair is open and Simcoe fair is open. If we're following,
Streaming general finance right now.
if we're following Ontario's guidelines, and that's what it sounds like we're doing, why are we the only one not having a fair?
Can I
I don't
speak to that?
understand that.
Can I speak to that?
I know why we're not having a
Sorry,
fair.
Michelle.
I know why we're not having a fair per se, because we didn't plan one, but according to this, we're not supposed to have a fair, but Caledonia and Simcoe are having fairs. So why is fair in that list of large gatherings that aren't supposed to take place? Whether we have a fair or not, it shouldn't be there if everybody else is having fairs.
So as it states in alert level green, A fair
No,
would
but
be allowed.
I know what it says here. So under large gatherings, you have a fair. You have examples of mass community gatherings and that, because you're talking about social distance and all that kind of stuff. You have the fair there. The fair shouldn't be there because Caledonia's got a fair and Simcoe's got a fair. So if we were able to do it, we should be able to have a fair if we were able to do it, right? That's what I'm asking. If all of a sudden we got real busy and got everybody together and organized a fair in September, we should be able to have a fair. There's no reason why we shouldn't.
So just, I'm not sure if the language, maybe this should say large community gatherings. It says includes but is not limited to. That just means that it could include other large or mass community gatherings. This isn't saying that we cannot have a fall fair. This is saying we could have a fall fair in alert level green and yellow.
I think just also just really quickly that to add to Sarah, maybe perhaps Michelle, I know you're still part of the planning of the fall fair, and obviously the committee has made some of their own decisions as well for the fall fair. So maybe Michelle, if you just want to just touch base on those plannings.
Yes. I guess it's not going to answer Helen's question because I know what Helen's saying is why is it even on there if we can have a fair? And just an update on the fair. We were going to have a full fair. However, I know that our plans had to go through ECG, and until I think Friday is when we finally had some feedback. So we've planned for a one-day gathering outside. Everything will be outside because it's my understanding that the community hall is still full of I guess the vaccination clinic or whatever it was, and same with the arena. So that's where we stand. So I don't think that answers Helen's question though.
Okay, thank you.
My question isn't a big, I'm not making a big deal out of it, but my question is simply, why is the fair on there if we're allowed to have a fair? It sounds like it's the fair, those names that you have there sounds like we can't have those, like the powwow and everything, but we can. We could have had all of that stuff. It's just the planning never took place because of being locked down before. That's what I don't know. It's just and as far as the arena goes, again, everybody else's arenas are open. I'm getting so many questions from people. Why is our arena not open? Why is our arena not open? So I'm questioning if everyone else has their arenas open, why do we not have our arena open? Does anybody have an answer to that one?
So to my knowledge on that piece, and I see Wendy has her hand up as well, and maybe perhaps even if there's any others on the line who could also add, but to my knowledge, that the plans are submitted for the arena and is currently being prepped to be opened. Wendy?
Yeah, I agree with Helen's concerns. I mean, and I understand that the arena is being prepared, but once again we're late in doing that. We're behind. I mean, people in the community have been going off the territory for a while to play their sports and do other things in other facilities. And it's that balance. We have to make sure that we maintain caution and make sure that there's safety in place for COVID, because it still exists, and going into the fourth wave, or we're in the fourth wave now, we have to have those things in place. But at the same time, I mean, the controls through the ECG have been so stringent, and the backlog of everybody having to go through them, and, not getting their responses, not being able to do things. My understanding of having this tool, this framework, is so people know what they have, they can utilize it and plan accordingly and do what they have to, instead of every single thing being vetted to the ECG. So I mean, I think just on that whole control, we need the balance there so that organizations and businesses and whomever have the solid framework. This is a structure, and then they can utilize that. If they have questions, comments, need help, then they go to the ECG. But that control is restricting and limiting, and we're behind all the time because of this process.
Okay, thank you, Wendy, for your comments as well. And again, can look to furthering that discussion at the ECG level. I just want to check in really quickly to see if our SAO Darren has any comments on this particular issue.
Yeah, thanks, Chief. First of all, I guess the way the framework is laid out, when it talks about large community gatherings or events, it's just describing what those could be. And Sarah did say that it is allowable. I mean, obviously, it's open in green and yellow with a little bit further restrictions. But yeah, there are plans to open up spaces to get them going. I think the last I heard, Cheryl was saying they're looking at September. I don't know the actual date, but for the arena, just kind of packing up the vaccination clinic. So that's going to happen the rest of this month. And then as far as, we can have a fair if it's organized. No problem. I just wanted to I guess, the way I read it anyways, that it's just really describing what a large event is. That's all it's saying. It doesn't say anything about not being able to do it.
Sorry.
Okay, thanks for that, Darren. I see Wendy has looked like a follow-up.
Yeah, I appreciate your response, Darren, but I think what's being said here is that it may say that, but people have been waiting on the plan, waiting for approval, because the process is everything has to go through ECG, be vetted, be approved, and back and forth. I mean, even with the arena, the vaccination closed in what, June, June?
Yeah.
In the arena, and it's been all this time and it's still not open. So that's what I'm talking about. And we have to look at the process. It may say that events can go on, but they can't because it stops at ECG.
Generally, I agree. My view was that we should be more open as well. But it was a couple of tight votes at the ECG table on the contact sport, for instance, as an example. So it's just kind of, we're sort of at that point where we're trying to find that balance, I guess. So maybe I'll just stop my comments there.
Okay, thank you. I see a few hands being raised, so I'm going to go to a speaking list. I'll start with Helen, over to Nathan, and then over to Hazel. Helen?
Well, I think it's a good idea to maybe start issuing what I call blurbs to the community. Issue a blurb to the community. This is why the arena is not open, but they're preparing. Issue a blurb to the community. This is why we're not having a fair. Like, people keep asking all of these questions, and I think we need to start giving the community more information that they can understand, because they're reading these as we can't do this and we can't do that, because that's what it sounds like. So I think we need to do better communication to the community. Maybe every week issue something to the community, like, just so, they know what's going on. And I agree with Wendy. That arena was empty way back when. Cheryl should have been working on her plan then and then getting it started. But if the ECG is holding up plans, that isn't right either, because Michelle said they handed in a plan. I don't know when they handed their plan in, but it just now got approved. You can't organize a fair in August that's going to take place in September. So something needs to be done differently. I don't know. so that these kind of things don't
Yeah, and I
come
think
up.
I think that's referring to Wendy's question in relation to process as well. So, you know, and need to look to furthering, or rather streamlining that process again. Nathan, and then over to Hazel, and then Michelle.
Yeah, thanks,
Up
Chief.
next.
Thanks, Chief. And just two comments. One in relation to Helen's blurbs. I think that's a fabulous idea, and we should move into providing those one hitters blurbs going out to the community, just on those clarification, because I think as counselors, we all consistently get the same calls, and we can filter through what those priorities are. And second, in terms of the process, it was my understanding, and Darren, correct me if I'm wrong, that the last DCG, we did talk about that process of quote unquote approvals, and it was kind of framed in a manner that we're starting to move away from that, because one issue is the amount of requests coming in, and the amount of bodies we have to review them. There's just not enough, and I think that was recognized as an issue at the ECG level. I can't pinpoint exactly the specifics of the discussion last week, but I know, Chief, we did start talking about moving away from that quote unquote approval system at the ECG to streamline it out in a more efficient and effective manner. So I think that's going to be important for us, because I see it all the time, right? It's a backlog, and it's due to the lack of capacity to deal with all of these proposals coming in at all different levels, whether it be sport, whether it be business. It's just an influx. So I know we discussed it. I just can't remember the specifics of the solution that we came up with on that issue.
Okay, thank you, Nathan, for that. I do see a number of hands, again, recognizing those hands, but just in relation to the speaking list, I want to go over now to Hazel, then Michelle, Sherry Lynn, and then we'll follow up with Sarah. Hazel, you have the floor.
Okay, thanks. I had read on Facebook where people were quite upset about the fact that the little kids that are practicing lacrosse had to practice in that intense heat. So I can understand the need for the emergency control group to have that control. But if the arena is free and there's nothing in there, then it should be open to the people to use for sports. Is it just communication that's happening, or what's really sort of jeopardizing the opening of everything? And I'm thinking now that I'm rather disappointed to know that we're not going to have a fair. I'm just wondering on that day if there's something that can be put together, because horse racing, do you have to plan for that? Or do you just tell the horse racers that there'll be a horse race? In ball tournaments? In ball tournaments, etc. Like, can it be on a smaller scale? I just kind of thought we were having.
Okay, thank you, Hazel, for your comments again. I think it's in a sense been answered as well, but I think we're also getting into specifics in terms of events and so forth. I know just from my past experience and on the fall fair, there was a point in time when we didn't even have a midway at our fall fair without any COVID in place. So I think even with the, like, say, for specifics for horse racing, I know even the fair committee at the time is looking at multiple things, because horse racing is actually quite expensive and doesn't really necessarily have the return in a sense, but again, I think Wendy had touched on this piece in terms of the process. It all relates back to the process of the approvals and so forth. I think Nathan also kind of clarified on those pieces, but nonetheless, again, we still have to get going because community is asking. But I do also agree with Nathan that communication and Helen in relation to her what she referenced as blurbs or community updates. I think those are the pieces that need to get strengthened, as well as again just looking to that streamlining of process. I'll shift over now to Michelle, and then Sherry Lynn, and then followed up with Sarah.
Thanks, Chief. And I think it does come down to process because in saying, Nathan, what you just said, we received a text as soon as we sent out that we were doing a one-day fall gathering instead of the fall fair because there will not be rides because we needed that answered in June. And not having that answer until last Friday, you can't plan. And so I think it comes down to communication. There's a whole bunch of areas I think that we need to look at. And with lacrosse, I just want to commend, I think our athletes have done very well and our community has done very well. The majority of our players are going off the territory to play sports this summer, which is very unfortunate when even baseball, right? Like our diamonds are there. We have a brand new diamond that's sitting there. And so I really think and commend our community who've actually taken the safety precautions and unfortunately have to go off the territory because we can't offer anything here. And so I think it comes down to process as well as communication. And if we're going to put these out, I would hope that then our departments are adhering to and opening up the facilities because that's the questions we're all fielding.
Okay, thank you, Michelle, for your comments as well. Sherry Lynn.
Yes, I agree with what everyone's saying because that last that I knew, for sure, there needs a better streaming process because when I was dealing with something that came about to play for baseball, they were told to go to public health. And now I'm sitting here listening that it's ECG still making that decision. So I'm even mixed up. So I can see where the community can be very mixed up. So I think what Helen's saying with these blurbs, we need to really make sure that the whole community is on the same page and giving the same responses to community members, because that's what I was dealing with. And last that I knew, it was public health. So I think some more communication in the blurb like Helen said. Thanks.
Okay, thank you. Thank you, Sherry Lynn, as well. I'll shift now back to, I'm sure Sarah has some follow-up questions or responses as well. Sarah, you have the floor.
Yeah, I just wanted to say in regards to that's why there was the change made for the team sports, that they follow the respective associations so that they don't have to go through ECG anymore. So that was to take that process and just put it onto the organization to do that safety planning. And in terms of the other events, again, that has been taken off of going through ECG. So it's just up to the event organizer to ensure that the event is being held in a safe manner, with the exception of the large community gatherings, just because of how just ECG recommended that still go through ECG just to oversee and make sure that the risk mitigation measures were implemented. But it was to take off some of the items that go through ECG on a daily basis.
Okay, thank you. Thank you, Sarah. I see Helen has her hand up.
Yeah, well, I'm hearing what Sarah's saying. If the associations don't know that, anyway, the association can make all the decisions they want to make, but if the arena isn't open, or the ball diamonds aren't open. Like, there's a big disconnect someplace. Anyway, it's confusing for me because I'm even getting a lot of calls about the schools. People don't know what's going on with the schools. There's the school. One woman said the school said it was public health's decision, and I called public health, and they said it was Kathleen's decision, and people are getting confused. They don't know whether to register their kids because they're not getting the information. I mean, when's the last time we put information out about the schools? Not everybody is on Facebook. Not everybody, the same old story. Not everybody's able to do what we're putting out there. So there's a lot of confusion with that as well.
Thank you. And that was also a question I believe coming in from community. And just to follow up on that piece, we will have actually the new person in and introduced Kathleen's role as the director of all federal schools on an update at our Tuesday general council meeting. So that's actually on the agenda to provide community update on schools specifically. But again, you're referring back to communication. So, I think that's exactly where we have to sharpen and furthering updating our community overall on multiple sectors. So just really FYI and follow up to your question on that piece. I see Michelle had her hand up, and then I'll shift over to Darren.
Yeah, I was just wondering when we're going to have that conversation to call off the emergency. I know I brought it up a couple months ago.
Yeah, so we actually, and we've had that conversation as well at the ECG, and I think it was recommended that we would still maintain in an emergency. And again, I'm looking to, and I apologize because it was my understanding that either Mike or Lori was to be on the call to assist in this conversation. So can further follow up on those pieces as well, Michelle. Darren?
Yeah, just flipping back to the previous conversation, I think with this new revised framework, the intention was, and if you look at most of the restrictions, it's maintain 2-meter distancing is mostly what it is. And I really think that's going to be our new normal. I'll just say that as my opinion going forward. But this is an opportunity when we pass this new revision to do the communication, to do the blurbs. This is what it means, again, really simple infographics by sector. I think that's what we need to move to this week and get that out. So that's just my suggestion on that, and taking some notes here. And Mike and Laura, I know Mike's away, and I believe Lori is also on vacation. So we can follow up with comms and get this together once we get this passed. So I think that was the intent. And Nathan's correct. There is a pivot away from, as well as Sarah mentioned this as well, about having everything go through ECG and moving it back to either the business owner or the coordinator or the association. And I've also asked Cheryl to give me an update on the dates for the opening. So we'll get that all into the communication to make sure that everybody's up to speed. And I don't see why that can't be done by, this week. So I'll stop there.
Okay, great. Thank you for that, Darren. Are there any, I'll just look to check in with Sarah. Is there anything further on your end, Sarah, in relation to your presentation?
Yep, I just have a few more items to just go through. I think Wendy has
Sure. I see Wendy.
Yeah, and sorry to pick at this, but something just flagged for me when Darren said both of our leads for ECG are on vacation at the same time. Absolutely, staff need vacation. However, it's a bit of a contradiction if we remain in a state of emergency, if it's felt that we're in a situation that deems that necessary, yet the two leads that are heading up the ECG are away. So it's a bit of a contradiction there, just to note that. I don't know if anyone else feels that, but and I have to say, I mean, thank you to Sarah for always coming forward and doing the presentation and taking all of this on. That's a huge place to be put in at every meeting. And I would hope that we can have the ECG, those core members here, if this is on the agenda.
Definitely, and thank you for your comments, Wendy. Again, totally agree. I think it's important that again we look to the process again if whenever anything pertaining to ECG, so that we're not left with multiple questions and again, not the answers that we want. So do agree and look to that point. I want to maybe shift over back to Sarah just to follow up the presentation because again, I was also looked to suggest even having, and I think Wendy for your suggestion on the piece of having just an evening session of ECG updates to have the core members here. Again, that could be part of the communication plan moving forward to start and address and eliminate some of the confusion around these areas. And I think that's a great suggestion. So we'll definitely look to those pieces as well. I'll want to shift back over to Sarah just to finish up her presentation and any further questions or comments prior to moving to the recommendation of approving version 2.2. Over to you, Sarah.
Okay, thank you. So again, large community gatherings, those are just examples, not to say that you can or cannot have them. It's just examples of what large community gatherings would be. Notes on capacity. So members of the same household do not need to physically distance while in a place of business or facility. And I think that can also be part of the communications piece. These sections are the same, but who do I contact for more information? We previously had, if you do not see your sector and are a non-essential business organization, or would like to host an event, to contact the emergency control group, but we have taken that piece out. Just to reiterate that any special events or sports organizations, they follow their respective associations, or the event creates a safety plan to ensure that we can ensure that we reduce the level of risk to the community. And that is all of the updates for this specific response framework. If there are any recommendations, on what council would like to see changed prior to reviewing, prior to approving, or if you're okay as is, please let me know at this time.
Okay, great. Thank you. Thank you again, and as well, to follow up, thank you to Sarah for all of your work. I know it's a lot of work doing what you do as our epidemiologist. So again, it's very appreciative. I just want to look to any final questions or comments for Sarah in relation to version 2.2.
It's Melba.
Sure, go ahead, Melba.
Yeah, I want to say that I hear all the confusion and sort of disappointments and plans that couldn't be in place for various reasons. And I think the reasons are, as Wendy has mentioned, it's been very stringent and there has been caution. So I think the ECG has certainly done a good job in allowing the community to continue to be safe. As we know, we're very concerned about the hesitancy in getting further people vaccinated, but we did a good job. And I think the ECG needs to be commended for that, even though there's confusion, and now it's opening up even more, and we're getting back to so-called normal to a certain extent. So thanks to ECG, and certainly it's unfortunate that we couldn't move a little faster, but we're safe. That's the main thing, is we're doing very well. We're safe. Thank you.
Thank you, Melba, for your comments as well, and do agree to those as well. I see Nathan also had his hand up.
Yeah, thanks, Chief. Just a real quick comment here, but I think it's more in preparation for the fall and we have to begin preparing for that because one of the things and the biggest discussion, whether you look at the province or even, as you know, the federal government has dissolved and are in election mode. But as we look to the fall, the fourth wave, which we know is coming, is predominantly going to be about the unvaccinated. And I think what we have to start preparing for on the communication side is the restrictions that are going to likely and potentially come out in relation to those that are unvaccinated, whether they go with that passport card, whether they go with a different identification piece. There is going to be some work as we go into the fall with those that are unvaccinated. And then you get into the human rights aspects of things, and then you get into fairness and equality. So I'm not suggesting that we motion anything right now, but I think we need to keep that in the back of our minds and ensure that our communication is prepared ahead of time to anticipate what's going to come down the pipe in the fall. Because I think it's going to be important. I don't think they're going to shut things down, but I think it's going to be targeted at those that are unvaccinated. So we have to be ready for that.
Okay, thank you. Thank you, Nathan, for your comments as well. I think, again, great points being made on this discussion. And so I will look to, again, Sarah is looking for if we are prepared to move at this time on 2.2. She's walked us through the changes. Obviously, we've noted a few comments in relation to process and communication. But at this time, I will look to see if we are prepared for a mover and seconder to accept version 2.2 of our response framework.
Mark, I just have one more comment or question. It's Melba.
Sure. Go ahead, Melba.
Nathan certainly has said we need to prepare for the fourth wave, which is already here apparently. And when Sarah began, she mentioned aligning with the province. And I'm asking right now, are we aligning with the province in respect to pop-up, what do they call them? Vaccination clinics. Are we going to do that? Because if we get 2 on a weekend, that's great. If we get 4, that's greater. We know that. So are we going to do the same thing? Are we going to go to them and allow them to at a certain time rather than wait? Question. That's a question for the ECG. Thanks.
Okay, thanks, Melba. So it's my apologies. So I just I need further clarification on your question. So you're suggesting that are we aligning with pop-up vaccination clinics? Is that what you're saying?
That's right. Yeah, because the communities are doing that. They're concerned, as we know, in certain areas also that they're not getting enough people vaccinated, and that's what's causing ongoing problems. So that's a question for the ECG. When, according to Nathan's comments, they're going to be planning for this, not specific pop-up, but planning how to combat the fourth wave. Thank you.
Okay, thank you, Melba, for your question. I'm not sure if Nathan, if you have anything further to add to the response, but we can definitely take back to ECG on that piece. But I know even with moving and shifting over to the vaccination clinic at the Shawinigan Public Health Office, obviously we need to get more creative in ways to the vaccination rates and so forth. So I think that's still a point of discussion, Melba. We can look to further, again, looking to the suggestion raised to really just have the core membership of ECG to be on the line and have further discussion across the board with updates specifically on the questions being raised. I'm not sure if Sarah, if you have anything further that you'd also like to add specifically to Melba's question.
I'm sure in regards to the pop-up clinics, we are looking at how we can do a pop-up clinic and do an information session specifically targeting parents and for our children to go back into school, and also follow up with a clinic so that people can receive their information. They can ask questions about the vaccine from our public health professionals and physicians, and can then learn about this opportunity for a pop-up clinic. So trying to provide education as well as accessibility for a clinic. So that planning is currently underway.
Okay, thank you. Thank you, Sarah, for your response. Are there any further questions or comments? Okay, seeing or hearing none, I'm looking to a mover and seconder. Are we prepared to accept version 2.2? Okay, I'm not seeing a mover and seconder. Oh, I see Helen.
I'll second it if Helen motioned. Melba.
Okay, Helen, you're on mute. Helen, you're on mute. We can't hear you.
According to, I think, Nathan and Sarah, the ECG met and they're going to make some of the changes about giving the sports organizations their own, to make their own decisions, et cetera, So that's not part of this presentation. Those changes, are they, Sarah? I don't recall hearing them. So if there's gonna be changes coming again, why would we approve this one? I want to approve the one with all the changes that they met and talked about. You know, that approval process is changing, right? According to what Sarah's saying, the ACG is going to get out of the approval process as much as they can. So wouldn't that be in here someplace?
Yeah, so team sports should follow their respective association guidelines.
So that's in there. But
And
the
then-
change in the approval process isn't in there, is it? The new changes?
So the events, special events, and sports associations do not have to go through ECG unless they're a large community event.
Oh, so that's in there.
Yeah.
Because I didn't recall you saying that. Oh, I'll move on it then. For now.
Okay, thank you, Helen. It's moved by Helen and seconded by Melba. Are there any further questions or comments? Again, obviously, we know that we'll look to the points that have been raised this meeting in relation to process and communication. Again, that will further come as we look to next steps here. Are there any further questions or comments in relation to the motion? Seeing or hearing none, all in favor? Any opposed? Seeing or hearing none, motions carried. Oh, sorry, Michelle, were you opposed? Oh, my apologies, one opposed. Motions carried. Okay, that being said, just want to say again, Yawa, and thank you, Sarah, for coming in front of council again and providing this update on version 2.2. Obviously, we have some notes and further items to follow up on. So we'll look to again the suggestions being made for again core members to be on the call and further answer any questions being raised. So that being said, just want to say thank you, Sarah, for all your work.
Thank you, everyone. Have a great day.
Yes, you as well. Okay, council, that leads us right into our next item on the agenda, which is the adoption of the general finance minutes of July 19th.
Chief?
Do you need second reading on that?
Oh, my apologies. I probably should take second reading. Thanks for that, Sherry Lynn. Is there a motion to waive second reading on the previous motion of 2.2 moved by Helen, seconder?
Second, Melba.
Second by Melba. All in favor?
Favor.
Any opposed? I think maybe one opposed. Michelle was opposed to the first. I think you're probably opposed to second reading. Motion's carried. I'll now look to the adoption of the general finance minutes of August 16th.
I'll move.
My apologies, of July 19th. Moved by Michelle, seconder. Second by Sherry Lynn. All in favor? Any opposed? Seeing or hearing none, motion's carried. I'll now move into item 5, which is Building and Infrastructure Committee recommendations. It looks like we'll need a mover in Audrey's absence. I have recommendation 1.
I'll move it. And do I need to read it?
Moved by Michelle. Yes, please, Michelle.
That the Building and Infrastructure Committee recommends to the Six Nations of the Grand River approve to award the Herald Road Access Road number 2 construction contract to Hill Site Services Incorporated in the amount of $479,861.50, and that the Senior Administrative Officer and the Chief Financial Officer be authorized to sign the contract and approve the expenditures per the signed contract and contract amount. Source of the funds identified as the Six Nations of the Grand River Economic Development Corporation Trust Fund. That's $465,515, and the Indigenous Services Canada Enhanced Funding, 20. That should say 21-22, I think. 14,346.50 cents.
I second that motion.
Okay, great. Okay, thank you, Michelle and Hazel, for that, as well as that just a minor correction on the date. Are there any further questions or comments? Seeing or hearing none, all in favor?
Favor.
Any opposed? Seeing or hearing none, motions carried. Is there a motion to waive second reading? Moved by Michelle, seconder.
Second, Hazel.
Second by Hazel. All in favor? Any
Favor.
opposed? Seeing or hearing none, motion's carried. I'll move into recommendation number 2. Again, we will look to a mover in Audrey's absence.
Number 2. I'll move that.
Okay, thanks, Helen. If you can just also quick read. Hazel, we're getting a lot of feedback from your call or phone. If you can just put yourself on mute.
Am I supposed to? Oh, I got to read this. Do I have to read it?
Yes, please, as the mover.
I'm sitting here waiting. Okay. Moved by myself, seconded by Hazel Johnson, that the Building and Infrastructure Committee recommends to the Six Nations of the Grand River elected council to support the application for the Six Nations water tower to the Investing in Canada Infrastructure Program, Green Stream Stage 2. Further, that the Six Nations of the Grand River elected council commits to contributing 6.67% of the total eligible costs should the application be approved.
Okay, thank you, Helen, for moving that. It's been moved and seconded. Are there any questions or comments? I see
I
Nathan
just
has
have
his
one
hand up.
question. I have one question now that I'm
I
moving.
second it.
The money is there?
Okay, thank you. It's been,
The 6.67% is there? That we're
so
supposed
I'll
to
look
contribute?
to, yes, I understand your question. I'll look to Anna Cecile just really quickly.
Yes, there was an estimation of how much that 6% was going to be.
Okay, so is it yes? Yes, the money's there if it's approved?
Yes, exactly.
Okay, thank you. Any further questions or comments? Nathan?
Yeah, same question as Helen. And maybe we should just indicate where the funding is coming from, where that 6.67 is coming from in the motion. And then I did have a question too. In terms of the proposal and how they're framing this at the government level, what exactly is a First Nation ultimate recipient?
Who is that?
I'm getting feedback, Hazel. It's still coming from your screen. Please, if you can, put yourself on mute. Or if not, if I can ask Becky or the host to please mute, as again, we're getting a lot of feedback.
Mute.
No, you're not on mute because we could hear you. Okay, perfect. There, now you're on mute. Sorry, Nathan, if you can just really again, repeat your question.
Chief, it was just along the lines of indicating where that 6.67% is coming from, like which budget line. And then the second question, I didn't really understand it in terms of how they're approaching the applications in the program. What is a First Nation ultimate recipient? Is that different, or is there different tiers of how they're doing this? Just a question.
Okay, thanks for that piece. Again, I'll just check in with Anna Cecile if we can add where exactly the source of funds of the 6.67 would be coming from. And if I could also maybe just check in with Darren on this piece, again, because I know there's specific questions to this application. Just wondering if you could assist in that response of Nathan's question. So first over to Anna Cecile.
Yes, when the Director of Public Works prepared the budget, he included already this additional funding. So it's part of his actual budget.
Okay, thank you for that, Anna Cecile. And then also, Darren, are you able to also comment in response to Nathan's?
Just quickly going through the briefing note again, didn't come on a committee, but I can follow up and give a response after the call. Why it's framed that way.
Okay, thank you for that, Darren. I see a couple hands being raised, Helen, and then over to Wendy.
Okay, I think I'm going to withdraw my support for this motion because there's too many unanswered questions. Like Anna said, the 6.67% was going to be covered, but it depended on how much it was going to cost. So we don't even know how much this, what it sounds like, we don't even know how much the 6.67% is going to total. I'm assuming it's based on how much they're going to get maybe from the application. I don't know, there's too many questions. I'm withdrawing my motion on this. I'm saying we should defer this until
Okay,
Mike is
thank
here.
you. Yeah, thanks, Helen, for that. It's actually really difficult to go through these motions when there's no director to actually answer these questions. I know Mike is on holidays this week, but if that's the case, then maybe we should even put it on the agenda, because it gets quite frustrating when all these items are on the agenda, then we ask all these questions and beat it to death, and the next thing you know, it all comes out and we're back to square one with no approvals. So again, we can withdraw this motion at this time and look to bring it back when Mike is present and able to hear to answer questions. Wendy?
Yeah, thanks, Mark. And I agree with that because I have a bunch of questions, and if it does come back, can it be broken into two motions? Because there's two different things. And there is a contradiction from what Anna described is coming out of Public Works budget, because this is saying that we're covering it. So they're two different things. So really need that clarity of what this is moving forward. And, to your comment about somebody being away, I mean, I'm sure there's somebody who's in charge of operations while directors are away. At least I hope there is.
Okay, thank you, Wendy, for your comments as well. So what we'll do, council, is we'll defer this recommendation, obviously, again, based upon the conversation and questions and further clarity. So we'll look to bring this item back with those questions answered. Michelle?
I was just going to say at committee, this was a added agenda item. So can we have directors submit the week before? That's why we go to agenda review. So everybody has all the information prior to going to committee. So then we can ask those questions the day it comes to committee, not just briefly go through it and try and pick everything out.
Most definitely. Thank you for that, Michelle. And we'll look to those pieces as well, and even further to Wendy's comments. I see Helen has her hand up.
Well, I guess given that Darren brought it, Mike brought it to committee at the last minute, is it time sensitive? In order to get, is there a date this application has to be in, I wonder?
September 30th was my understanding.
Chief, it says September 9th. Applications are due by September 9th.
So are we going to meet by September 9th to talk about this?
Yes, we are. And again, to further follow up, if it's again so important, I would assume the director would send a designate as Wendy's comments to this item. It's on the agenda. There's multiple questions. So if it's time sensitive, obviously, looking to that piece. So with that being said, we will have a meeting prior to then to get this submitted. Are there any further questions or comments? Okay, seeing or hearing none, we will look to defer this item and bring this back further, obviously before the time frame. I want to move on to requests for donations. You'll see your sponsorship package attached. There is 2 requests for 2 events. The first one is Golf for Timbuk, and the second one is the Lansdowne Children's Center Foundation. So I'm just wondering, Becky, I think, are you the one to be speaking on behalf of these 2 sponsorship requests?
They were submitted to me to put on the agenda. I don't know a lot about them.
Okay, thank you. So I just wonder in terms of process, because I know there's a certain specific, obviously the donation fund as well. So I'm just wondering if there's other requests that are the same, that there's obviously fairness across the board in that sense. And obviously with golf tournaments and so forth, there's many tournaments obviously getting out of COVID, but even in pre-COVID that would come up. So I'm just looking to that piece. I see Wendy has her hand up.
Yeah, thanks, Mark. Yeah, and that was my question. Like, I thought we had a donation fund. Is there criteria? Has this met the criteria? What's the recommendations coming from that process? Yeah.
Okay, thank you. Thank you, Wendy. I see Anna Cecile has her hand up, and then over to Helen.
Yes, there's a committee for donations, and it's the director of policy, me, and 2 more, 1 member of the community and 1 in Teresa Longboat are members, but this was not sent to us. There's a policy for that, so I'm not sure. Why is it coming to council? I think it should go to the committee.
Okay, sorry, my apologies. That was my understanding that it was already through committee. Again, that was my question in relation to this as well across the board. So without further going back and forth, I'm gonna just right away send it over to committee, defer this item, and then we won't go back and have a 15-minute conversation, and we'll bring this back. If that's okay with council? Okay, perfect.
I have a
Moving on
comment.
to the signing of,
I have one
oh,
comment. It's
my
my
apologies,
understanding.
Helen.
It's my understanding that the donation committee is for youth. It's not just for anybody. It's anything to do with youth. These kind of donations, if you all remember, used to come to us, and that's what we'd use the remainder of the OLG money for, was to cover these different kinds of things. So you might want to check your criteria for the youth committee before you send it there. I mean, for the donation committee, I'm pretty sure it's youth.
It's actually not just related to youth, but I do hear what you're saying on that piece. So again, I want to have a further conversation even with that committee to look to further expand that, because again, yes, I do recall in the past of these types of requests, even with gala requests and so forth.
Yeah.
You know, and purchase tables. So again, that was all I think in relation to the policy and being needed to be added to that. So we'll have a further conversation. It's a good point of discussion, Helen. Again, we'll bring these items back once we have these clarified. I'm going to move on to number 7,
Mark,
which is the
Hazel.
signing authority. My apologies. Sorry, go ahead, Hazel.
Yeah, I just wanted to make a comment about these sponsorship requests. If I recall correctly, I thought the last time a request came forward for a golf donation with regard to this specific one, that was denied, because I know in the past that was sponsored. So is there a limitation when you ask for a donation for a golf? I don't even know what to call this. Is there a limitation as to how many times you can ask for donations to put on a golf tournament? Because some people make theirs an annual event. So is it an annual request? You can go each time to council? There are so many tournaments happening too.
So yeah, again, thank you, Hazel, for your comments. That's again part of the conversation and discussion I want to have in relation with the donation committee in its entirety. Again, I think rather than focusing specifically on golf tournaments, you know, and this is the one that is currently on the agenda, I think we need to look across the board and what we're doing in terms of moving forward from this point on.
Okay. Thank you.
Yeah, thank you for your question. Okay, moving on to number 7, which is the recommendation for we need a mover and seconder on a signing authority. Again, it's approving that Jennifer Cord, Director of Financing, Reporting and Analysis, will be added as a signing authority on all Six Nations grant of elected council business accounts, and that signing authority for Sampson will be removed effective immediately. Is there a mover and seconder to that motion?
I'll move. It's Melba.
Okay, moved by Melba, seconder. Is there a seconder to the motion? Second by Sherry Lynn. Questions, comments? I see Wendy.
Yeah, I have a question, but I don't want to cross the line in terms of staffing. So I'm not sure how to pose it. I just
Okay,
sorry.
Sorry, Wendy. So how would you like to proceed? I don't.
Well, I maybe I missed something, but I don't know. I mean, it's obviously a new staff person who's come in. I don't know when they joined us. I'll put it that way.
Okay, I understand your question now. So I'll look to Anna Cecile again, this was part of the chart that was given, I believe, in budgets last time. So Anna Cecile?
Yes, so in January of this year, there was a new structure proposed for the finance department that included a director of accounting and a director of planning, analysis, and financial and reporting. We hired the director, but unfortunately, the person was here for a very short time, maybe a month, if any. So the position was reposted.
I'm sorry to interrupt, but maybe we should do this in camera because I'm just cautious of crossing the line in terms of staffing, and it is an open public meeting. I'll look to Darren for.
Yeah, thanks. I think, yeah, matters of personnel, I would prefer if we did it in camera, so we can address this in the in-camera session.
Okay, thank you. Thank you for that. So we'll shift this item into the in-camera for further discussion on this piece. Are there anything further in relation to the agenda? I know we have one additional new business item, which is Wendy.
Thanks, Mark. Just getting lots of questions about bread and cheese and the planning for that, and the timing, which we've talked about because it's Friday, it's in an afternoon, people work, all of those things, taking time off. But the latest concern, which is valid, is for our elderly citizens in the community. People who are 80 and plus who look forward to it. How do they get their bread and cheese? And I think that's one item. And the second one is, again, providing clear communication that we have changed what this is in terms of bread and cheese. We're not celebrating the Queen. We're not celebrating Victoria Day. We have changed it. We're changing what the tradition is, I guess.
Okay, thank you. Thank you, Wendy. And again, there'll be further updates to full council on this item. But I know the discussion at the planning level, they've also have looked to those concerns as well. And they actually are looking to actually deliver as much as they can to our seniors and elderly. So obviously the Iroquois Lodge, the cabins, and any other senior citizens, again, that are looking for that specific request. So I know that is in the planning right now. And also in relation to your second question to bread and cheese of the changing of the narrative, that's why you'll see as well, we're encouraging people to also, wear their color orange, again, to continue the awareness of, the Every Child Matters and the things that are happening in relation to the Mohawk Institute. And so, we're going to continue to push that out through comms as well. And really just community togetherness and coming together as a community to celebrate each other and really post-pandemic. So we are communicating those pieces. And we do have further, I believe it's tomorrow, a meeting planned with the organizing planning committee just to again further go through the details of bread and cheese. The only piece that we were, because it's already been advertised as the Friday, we do recognize that piece of concern. And again, it was just based upon that decision of wrapping up community awareness. And so that's something that I think, since we've already been advertised, something that we can't really move on just based upon that, and we'll insert more confusion. But that's just to answer the other, your first two questions, and we'll look to providing a further full detailed update in the coming days.
Thank you.
You're welcome. Also, I believe, Wendy, you had a question, I'm not sure if on Chiefswood Road.
Oh, I did. When is it going to be open? Because I thought it was today, the 16th. But I had to go pick up my iPad this morning and it was still closed. So I'm wondering how many other...
I do recall.
Sorry, go ahead.
Yeah, I'm sorry, Wendy. I do recall again, it's also, that was what I just gave on my radio update, that it is today to be opened on the 16th. So I'm just going to check in with Darren just to clarify if there's been any other changes.
That was my understanding too, Chief. Carrie, do you have any other additional information about why it's delayed?
I don't know if Carrie, if you could hear us now, but again, I
At our
think
meeting,
nonetheless, oh, sorry, go ahead, Carrie.
at our meeting, I can't remember if Mike made a suggestion that, or just made an update that the date was going to be changed. I don't know whether it was the 16th or whether it was later than that. I can't
So
remember.
just to my recollection, it was that was the delayed date change was to today. It was actually supposed to be open earlier. And so, you know, I've actually sent off a few text messages to our Director of Public Works. So maybe off the line and to full council update, we can provide that update later today because technically it's still the 16th. Maybe it's going to be open at 4 p.m. today.
There you go.
Okay, so we'll further get the answers to your question in relation to that, Wendy, and we'll provide an email update.
Okay, thank you.
You're welcome. That being said, that's all the items we have for the open session. Can I then look to a motion to adjourn the open session? Moved by Sherry Lynn, seconder.
I will.
Is there a seconder to adjourn? Moved by Michelle, or second by Michelle rather. All in favor? Any opposed? Seeing or hearing none, motion's carried. Thank you all for joining us this morning on General Finance.